TTC Medical League is here to talk and raise awareness about mental health. We have two speakers in our midst this morning, Dr. Babatunde, who is a family physician and the head of the Medical League, and we have Dr. Mutunrayo here as well. She is a psychiatrist. So let's get into our questions this morning. So we've watched the video, and it's obvious that sometimes we know when someone is mentally ill. We can tell, we see the person feeling down, we see the person feeling sad. But sometimes it's not obvious. We can't really tell, this person is always happy, this person is always active, this person is an extrovert, this person is all over the place. So I want you to help us explain to us what is mental health and what is mental illness.
Okay, so I usually start by saying that if you have a brain, you have mental health.
Yeah.
The brain is the seat of your mind, not the heart, not the chest. So mental health has to do with anything that the mind controls. And what are these? The way we feel, those are our emotions. The way we behave, those are our actions. And then the way we think, our thoughts. And you will agree with me that every human being, functions in this way. So that is mental health. Yeah. And mental health helps us to cope with the normal stresses of life, because life is stressful. Even for young people, it is stressful. And it helps us to also fulfill our potential, our God-given potential. So just to make it clear in a very simple term, our mental health entails how we feel, how we think, and how we behave. Now, mental illness has to do with when something goes wrong with the mind. And just like I've explained, that mental health encompasses our behavior, our thoughts, and our emotions. Anything that affects the mind would also affect these three areas and be exhibited in this area. And then what are some of these common mental health problems? Depression, which is the commonest worldwide. And depression is not just I'm feeling sad. You have to meet criteria for other symptoms as well as a specific duration. And then we have suicide. Then we have anxiety disorders, which are quite many. And then we have the psychosis, which includes schizophrenia and other psychotic disorders. And these are the ones that everybody knows about, and maybe why we fear mental health generally, because it shows in the behavior. The person loses touch with reality. And then we have reactions to trauma. When people have experienced traumatic, have had traumatic experiences, then you have things like post-traumatic stress disorder, PTSD. You have adjustment disorders, and you also have acute stress disorders. And then we have mental health conditions that also occur in young people and also in old age. So I think these are examples of mental health.
Thank you so much, Ma, for helping us see the difference between both of them. Dr. Babatunde, I know you see a lot of people presenting in your clinic with physical symptoms of physical illness, right? But is there a relationship between physical illness or physical health and mental health?
All right, thank you very much, man. Good morning, church. Again, it's to say that, one of the ways I like to look at it is that most times when people present in a healthcare facility, especially in our part of the world, most people would not likely go in to say, I'm feeling sad. Okay, most likely people would present with something people would likely present with something a little bit different, which could be a telltale sign of a possible mental health disorder. Okay, let me give a few examples from practice. Okay, so for example, sometimes you have women who are unable to achieve pleasurable intercourse. They have extreme pain during intercourse, and you evaluate and you find that there is no physical cause of the pain. You evaluate a bit further sometimes, and you found out that there's been a traumatic experience that has taken place earlier in life that has associated sex with pain, and so they keep on having that pain, and then that so that could be what you might call maybe a physical manifestation, as the case may be. I can give several examples. I've seen people who have had severe headaches, for example, that has not yielded to analgesics or has kept them on analgesics long time, right? And sometimes when you probe a little bit further, you discover that there is an underlying stressor that they are facing that is actually producing the headaches. You know, there's one type of headache, for example, we call it tension headache, right? The muscles are actually tense. And you know, that's what happens in your flight or fight response. When there is an imminent danger, the body reacts by getting your muscles tense, getting your heart rate up, and you can see this over and over. Again, many times, for example, Dr. Motrayo talked about depression, and you know, sometimes there are some symptoms that people would present with, doctor, I've not been eating very well, I just feel tired, and everyone has malaria and typhoid until proven otherwise, or maybe I'm not sleeping well, I'm sleeping too much, and we look at it that, put them on a sleep medication, but sometimes that in itself can be a telltale sign of a possible mental health disorder.
Thank you so much, sir, for helping us see the relationship between two of them. So our final question, I know if I go around the church and ask, what are the things we can do to actually improve our physical health? I know a lot of people already know that eat well, diet, exercise, but can you give us a list and maybe some examples of things that we can do? Because we know that mental health is on a continuum. So you might not be mentally ill, but you might not also be mentally healthy. And there are things that you can do that can promote mental well-being. So can you give us examples of that, ma'am?
Absolutely. So incidentally, where you started from are some of the things we can also do to maintain good mental health. We take for granted things like sleeping well. It's recommended that adults should have sleep between 7 to 9 hours every day. This puts you in optimal mental health. If you have difficulty falling asleep, staying asleep, or you have what we call intermittent awakening, you keep waking up on and off, then it's a problem. So sleeping well, achieving good sleep, at least 8 hours every night. Some adults feel it is impossible, but it has wide-ranging improvement on our mental health. Secondly, also nutrition. It also has effect on our mental health, physical activity. But then let's get back down to some of the other things we can do. Stress management. Stress is a part of life, but when it becomes overwhelming, then it becomes, counterproductive. So we need to also learn how to manage stress. And one of them is, we're children of God. We cast our burdens on God. We cast our burdens truly on God and not just feel that we're doing that. And there are things that are not within our control. We need to learn also to let go of certain things, because when we also hold on to things, it might keep on hurting us. And then mindfulness is also something that we need to take note of. And what is mindfulness? Mindfulness means staying in the present. Staying in the present. When you're eating, you know what you're eating. You can feel the taste. You can tell the texture. You know where you are. If I ask some people to describe the church now, they can't, because their mind is obviously maybe in Canada or maybe at home, or how they'll cook the next meal or take care of the children during the week. So we need to learn how to situate our mindset in the present, in the moment, whatever we're doing, because that helps to calm us down and also helps to prevent anxiety. And then finally, boundaries. We also need to learn how to draw boundaries. Boundaries with ourselves, boundaries with people around us, boundaries in the workplace, and so on and so forth. These are other things that we can also do to manage mental health. And finally, I think I still have some time. I'm smiling because mental health takes a lot of flack and is highly stigmatized. But what I usually tell people is that if we can agree that the mind can be sick, the legs can be sick, the heart can be sick, the brain also can be sick, and it can affect the aspect of the mind. So prevention and early detection also helps a lot. Let's not wait until things get out of hand. Don't feel, stigmatized or feel somehow to talk to a mental health specialist. It doesn't even have to be a psychiatrist. It could just be a counselor or a psychologist. Because when we act fast and we act well, we're able to mitigate serious problems. And this is also one of the ways by which we can live more healthier. And like we always say, there's no health without mental health. Thank you.
Thank you so much. Please, can we give a round of applause to our speakers? Okay. Just one more.
Right, to say again is, I usually like giving this example when I'm getting patients into count therapy. I say, if you break your leg right now, and I tell you you need to see an orthopedic surgeon, right? You are not going to argue that, right? So how come it is, and nobody is going to say, just man up, stand up, start walking. Be a man now, okay? Because you realize that there is a trauma that has taken place that needs to heal. In the same, unfortunately, when it comes to the mind, we ask, just man up, just be happy and all of that. Oh no, why do I need to see a counselor? Why do I need to see a therapist? Okay, and just to say, the Bible says, is there no balm in Gilead? Why is there no healing for the health of my people? It's just to say that, remember that health also includes our mental health. Thank you.
Thank you, everyone. I hope we've learned something this morning. So we're leaving us with one more thing, which is a breathing technique. It's called the 4-6-8 breathing technique. And we're also going to be doing a progressive muscle relaxation technique together in the next 60 seconds. So media, please, can you help us? Our numbers are projected there. If there's anyone that needs to see someone, to talk to a psychiatrist, to talk to a clinician, please take the number or just walk into the clinic. Media, can you help us? So everyone, please follow the sound of my voice. I want everyone in the church to relax now. I hope I'm audible. So like we've said, we need to be mindful. So be in this present moment and just follow the sound of my voice. So everyone, I want you to take a deep breath in, like you're pulling in all the air in church. Very good. Now hold it. Don't release yet. Now when I say release, I want you to open your mouth slowly like you're blowing a balloon and relax. Exhale, everyone. Very good. We're going to do a progressive muscle relaxation technique. Everyone, I want you to look at me and raise your shoulders high up like you're raising it to your ears, like your shoulders can touch your ears. Just look at me and follow. Very good. I want you to lift it very high. Now I want you to bring it down slowly, and I want you to feel the tension leave your body as you're bringing it down slowly. Very good, everyone. We're doing a good job. We're going to do one more. I want you to arc your back like you want your back plates to touch each other. Very tense. I want you to go back, push it back, push it back, push it back, push it back. Now slowly bring it forward to its normal state. Slowly bring it up to the normal state. So I want to give yourself a round of applause. Thank you so much. God bless you.